You're listening to the Dr. Shoup Show. Let's get back to improving your life with exclusive information and consultation. More insider info is online at ddsradio.com.
And as we walk down the hall and turn the corner and take our seat in Dental School 101, the professor is going to talk to us today about, see if you can guess it, what do your concrete driveway, the Liberty Bell, your butt and teeth have in common? Cracks. They all have cracks. And cracks are a normal process of us playing with teeth, and we're going to talk about that because it is a subject that most people, honestly, most dentists don't understand. There's a significant amount of controversy about what to do if a dentist looks in your mouth and sees that you have a tooth with a fracture in it. Well, don't dismay, don't worry. Your host, Dr. Randy Shoup, will tell you what they should be doing about your tooth. Now, we're going to talk a little bit of background here. Let me tell you about this whole process. I want you to imagine, if you would, the entirety of your tooth sitting down inside your jaw, okay? Just kind of get a picture. You've got the top of the tooth that sticks up a bunch above the gums. You have the root of the tooth that is embedded in either your lower jawbone or your upper jawbone. So the root of your tooth goes up there. So the jawbone is hard. The tooth is hard. The top of the tooth, the enamel that you bite on, is hard. And so if you were to chew hard things, there is nothing that acts as any kind of a shock absorber. So you and I, if we were to chew hard things, if we were accidentally to bite down on a cherry pit, if we were to gnawing on rib bones or something like that, we would shatter every tooth that we have. So our bodies, Mother Nature, has built in a system. Number one, all the way around surrounding the entire root system of your tooth does not actually stick and attach to the bone. There is a small layer of real rubbery elastic cells it's called the periodontal ligament, and the periodontal ligament actually suspends your tooth in the bone like a hammock. Okay, so the tooth isn't really just anchored to the bone. It sits in there. And as you bite and chew, that periodontal ligament acts as a shock absorber. It absorbs the pressure of biting, and so it gives your tooth a little bit of flex. The inside of your tooth, the cementum, the root surface of your tooth, is also very spongy as bones go. It has a bit of flex. If you go up inside the inside of your tooth, the meat of your tooth, it's called the dentin, it also has give and flex, and it will compress and it will bend. And then you get to the outer covering of the tooth, which is the enamel, which does not bend, okay? It is a crystal structure. So your body has about 4 layers of protection. If you bite down, the periodontal ligament will absorb that effort. If you bite down even harder and completely jam that ligament so it can't move anymore, then the root of the tooth will flex. And if you jam down on it even harder than that, then the meat or the inside of the tooth will absorb this extra pressure. And then if you still go beyond that, the enamel of your tooth will compress and flex and put little tiny hairline stress-relieving fractures. It's Mother Nature's way of keeping you from absolutely destroying and breaking off every tooth in your head. You're listening to the Dr. Randy Shoup Show. I am your host, Dr. Randy Shoup, and we're sitting in class, Dental School 101, and I'm telling you about the whole process about cracked teeth and how about most dentists really don't have a very good handle on what to do about if you have a crack in your tooth. Now, if you exceed all of those forces, then we will have a catastrophic situation. We have patients who are heavy duty bruxers and grinders. They are the people that will fall asleep at night, and people in the other end of the house can hear them just going grinding there, and they will destroy their own teeth. I mean, their own body will destroy their own teeth. They have exceeded all of those things. If you have a tooth and somebody decides to put a great big silver mercury filling in the middle of it, and then you weaken the top of the tooth terribly, and then you're chewing, cycling on it, and then all of a sudden you bite down on something and the whole inside of your tooth breaks away. You have exceeded the tooth's ability to withstand these catastrophic pressures, okay? So now, it is common that anytime you go to a dentist and the dentist says, oh my goodness, you have broken off part of your tooth. Oh my goodness, I see a crack in your tooth. If you go to the dentist and say, hey, doc, I can't chew on this tooth over here very well. Every time I chew a certain way, it's really painful. The doc looks at it and goes, oh, my gosh, I see a crack here in your tooth. I don't see anything else much really wrong with it, but there's a little fracture here in the front part of the tooth. The next thing, 99.9% of the time that the dentist will say, and you know what I'm going to tell you, the dentist is going to say, you need a crown on that tooth. I'm here to tell you right now, there is absolutely zero, I'm telling you right now, zero data to support that if you have a crack or you've cracked off a piece of your tooth, that the tooth requires a crown. The data, the research, the evidence actually indicates the exact opposite. That if you have a crack in your tooth, if you've clunked off a piece of your tooth that has cracked away from chewing or biting on something extra hard, a tooth will survive significantly longer and be significantly happier if you do not put a crown on it. And that's what I'm going to tell you about. You're listening to the Dr. Randy Shoup Show. I am your host, Dr. Randy Shoup. And we're going to talk about in the next segment about this amazing conference I was a part of. I was a student as well as a teacher at this conference, the Academy of Biomimetic Dentistry, and one of the big topics was, what do we do about fractures and what does the research indicate about cracks? Cracks in teeth, that's what we're talking about. You, your concrete driveway, the Liberty Bell, and your butt and your tooth all will have cracks in them eventually, and it's Mother Nature's way of doing things. But you do not, you are significantly healthier if you do not have your dentist put a crown on that tooth. You know, we talked about crowns versus onlays, and several months ago, and it has been without doubt one of the greatest stimulators of phone calls to Microscope Dentistry by Shoup, because everybody that called said, hey, I've just been diagnosed as needing a crown on my tooth. We've had happily hundreds of folks that have called up and said, hey, I just got diagnosed. The dentist just told me I needed a crown on my tooth. And I heard your show, and I'd like to come in and see if you really think that I should have a crown done on the tooth. I will tell you, without exception, without fail, every one of those teeth that I have seen that has been diagnosed as needing a crown did not need a crown. I have yet to take even one patient, one tooth, and look at it and go, no, this thing needs a crown. That guy, that dentist was right. No, it's a crown tooth. That's for darn sure. I have yet to do that. We've been able to restore every tooth that has come to me when somebody else said, oh, you got to have a crown on that tooth. We've been able to do them with inlays and onlays and reinforcing buildups. And so here is the state of the art right now in terms of what a dentist should do if you have a crack in your tooth. You're listening to the Dr. Randy Shoup Show, and I am your host, Dr. Randy Shoup. Shoup, and I am trying to make you a smarter dental consumer. I'm trying to give you more information. I'm trying to let you ask better questions at your dentist's office and be more skeptical, because you need to question things in order to get really the best treatment for you. Here is what we do. If the crack in your tooth is superficial, which means it only goes down into your tooth a little bit, a millimeter or two, you do not need to do anything extraordinary about restoring that tooth. And the last thing on this planet that you need is a crown on this tooth. Those are naturally occurring, supposed to be there, stress-relieving fractures, and everybody gets agitated about them because they don't understand them, they don't know where they came from, they don't know why they're there, and so they crown everything. Just put a crown on it. A crown will protect it. No, it won't. That's just silliness. Number two, if a crown does indeed go deep into your tooth, or if they take the filling out and they can see a crack running right along the bottom of the tooth, right where the filling was, what you can do is, we make now Kevlar woven fibers that we can bond over top of the fracture, and it in essence glues the fracture back together. Then you can restore the tooth with an inlay or an onlay, and they have absolutely exactly the same survival rate as crowns do. And if you think about how likely you are going to be to need a root canal if you put a crown on a tooth, these more conservative restorations, not crowns, actually give your tooth a better life expectancy than if you were to put a crown on it. So, if you have a crack in your tooth that is superficial, don't worry about it. Do not put a crown on it. If you have a crack that is deep inside your tooth, then have the dentist bond over it with Kevlar fibers and then restore it with an onlay. But never, ever, ever, anywhere in this conversation did you hear me say, oh, you need to have a crown on that tooth, because it isn't supported by the data and it isn't supported by the research. And so there you have it. You are going to be now smarter than probably, I'm not kidding. You have more information, more up-to-date data than probably 85% of the dentists walking around. You are better equipped. You're better informed. Congratulations.
You're listening to The Dr. Shoup Show. Exclusive insider info, audio, and video is online now at ddsradio.com.